All right, everybody, let's get started on the prescription process. So a couple objectives. So most important things, prescription all the way down to patient counseling. And then we'll talk about every individual step in between. And then we'll talk about what a technician can do versus the tasks only a pharmacist can do. And there's really only three. And the three are counseling, interpreting data, and verbal orders. That's it. Those are like the main three things. So interpreting data, verbal orders, and counseling. That's pharmacist duty. Everything else, technicians can do as well. All right, first thing that happens, the prescription is written or created electronically. And those who can write are listed here. So medical doctors, other doctors. So they have specific disciplines like their psychiatry, or in this case, osteopathy, then they're MDs first. They just specialize in something else. So definitely they're above the qualification. What's a DDS? You go there twice a year, hopefully. Put you in a chair, lean you back. Yeah, that's a dentist. What's a DVM? Yeah. So do your pets need meds sometimes? Yeah, so we'll prescribe them prescription only meds. Nurse practitioner, depending on their state and local laws and their qualifications. Physician's assistant, and in some areas, pharmacists. If they're trained, they can actually write prescriptions as well. So it depends. That's why there's this etc., etc. State and local laws. Community pharmacy, that's retail, directly to patients. That's kind of dangerous because we're giving them like this magic potion, expecting them to use it properly. Institution, so inpatient, like hospital. The pharmacy give the drugs to the nurse or the hospital staff, and then they give it to the patient. All right. Prescription is written or created. Nowadays there are e-scripts. And then it has to go to the pharmacy somehow. It can physically go to the pharmacy in the form of the hard copy. All right, what you guys are probably traditionally familiar with, piece of paper, scribble on it. That we looked at some for online A. So make sure you look at that video for all the hints. Or in this case, emailed, scanned, fax, electronic data interface. So it has to get to the pharmacy somehow. And what the pharmacy need to do is check it. Is it complete? Is it correct? Is it feasible? Is the strength correct? If it's for a narcotic, is it signed? Does it look like it's fishy? Did they alter it in any way? So just double check, make sure it looks okay. Next we do is we'll enter in the patient info. Patient and prescription info. So you want the drugs? All right, I'll enter in the information and then I'll determine a cost for you. Right? If they're a cash payer, we can skip the next part. Right? If they're just straight private and cash, we don't have to go through billing. They're just going to give us the cash, we negotiate a price. But if you have insurance, we want to make sure we're going to get paid for the medication. We do not fill meds until we know that it's going to be paid for. So once you know you're going to get paid for the medication, most pharmacies set it up where that's only when a label is generated. So that's kind of like your signal when you hear the labels printing. The printers printing off labels is, hey, it's time for me now to prep the prescriptions, fill the medication. So usually labels are not printed until we know we're going to get paid for it. That's the technician's clue to, hey, take that label off the printer, start filling it. Second check by the pharmacist, very important. Patient picks up the medication, and by OBRA 90, we have to offer the counseling but it's only the pharmacist that can do the counseling. So this is different than a medical assistant task. So a medical assistant, you have to do patient education on their medication. You have to tell them how to take it, what's it for, what signs to look out for, when to come back. So that's part of the MA duty. But in pharmacy, that counseling is only a pharmacist duty. A technician will need to refer those questions to the pharmacist. So that's where the scope of practice will differ. Abbreviations. So you guys will build upon your abbreviation list. You guys are now familiar with many of the ones for the routes. So let me throw one out for you. What is S/S? It's on the board, it's right there.
Swish and swallow or swish and spit out?
Yeah, so that's a new one. So certain medications you're going to swish and swallow. Others you swish and spit out. Dosage form, you guys are familiar with most of them. Time of administration. So you guys know the difference between when awake and around the clock dosing. If not, go back to SIG codes 2. Math, this is all math. Measurement system. If you're not familiar, what do you review? SIG codes, SIG codes, SIG codes. Right? Very important. So have you guys been getting 100% on all your assignments? Killing 1 or 2 patient? 1 out of 25% death rate. All right, so just be careful. We use that triple check system in pharmacy as well. All right, prescription. Sample prescription from the doctor. So in this case, the doctor is the provider. If you move about protected health information, you're required to have an MPI number. Here's his DEA number for controlled substances. So that MPI number is 10 digits. So anybody who uses protected health information under HIPAA needs an MPI number. Doctor, insurance companies, pharmacies, anybody dealing with PHI. Date it's written. So when does a prescription for C2 expire? When does it expire? 1 year, holy smokes. I can get my morphine a year from now?
Oh,
7 days.
6.
Yeah, 7 days.
Oh.
See, 3, 4, and 5, you get the 6 months, right? Because you get 5 refills within 6 months. And then usually for RX only, you get up to that 1 year. So those are the expiration dates based on the controlled substance schedules. So just be wary, mindful when you get a prescription in. Inscription, that's drug info. Drug name, strength, amount. Whereas the signa is directions. So separate the directions from tablets, drug name, the amount of drug, etc. Prescribers, mostly only on controlled substances. You want to make sure you have that signature. A lot of times, now they'll just sign electronically. Dispense as written. Do brand and generics differ? Oh, I was supposed to be there. Brand and generic, do they work the same or do they differ? Exactly the same? How do you know if they work exactly the same? You got those therapeutic equivalence ratings in the orange book, which is found in the red book. But sometimes the doctor will say, hey, give them the brand only. They've been using the brand's been working. If we switch, it might do something weird, right? So sometimes a doctor might specify, and they'll just put a check mark here. So what do you think will cost more, brand or generic?
Brand.
So why is the insurance being billed higher costs? And if you tell them the doctor wants them, most likely they'll pay for it and it'll go through. If you don't push that dispense as written, it might get rejected for the higher cost. Refills remaining, so it's 11. So this looks like it is a prescription only drug. And then patient info. So this is the hard copy. What does MPI stand for? We just did it 3 minutes ago.
National Provider Identification.
Yeah, National Provider Identifier, Identification. How many digits? 10 digits, very good. Which of the following cannot prescribe?
LVN.
What's an LVN?
Licensed vocational nurse.
Licensed vocation. Sometimes they're LPNs. You ever heard of that? Licensed practical nurse. So they can't. So family nurse practitioner, yeah. Doctor of osteopathy, dental surgery. So the rest of them can. LVNs, LPNs, not quite there yet. Who's required to use an MPI number? Only people who prescribe medication? So only doctors?
I mean, who has the ability to prescribe it?
Only doctors? Only pharmacies don't need one?
Oh, yeah.
Insurance company don't need one?
Yeah.
Who needs one then?
People who deal with medicines.
Not people who deal with
No.
medication. People who deal with
Prescribe.
what's PHI?
Protected health information.
Under HIPAA, right? So anybody, because this guy's gonna talk to this guy, right? Hey, my patient needs a refill, and then this guy goes, hey, I need some billing, and then this guy goes, hey, I'm talking about this patient. They can't get it because it got changed, so they got to talk to the doctor, and then they got to talk to them, right? So because they're moving about patient health information, they need that number, which is not part of the inscription. So what is inscription?
That's the
That's the
making of, right?
who?
Like, to tell you.
Inscription is just drug info.
Yeah.
So which of the following is not drug info? None of the above. Everyone agrees? This is
Directions to use.
the signa, right? So that's different from the inscription. All right, make sure you guys are critically thinking, taking notes. All right, place the following in the correct order. So just run through your head. What's the first thing that needs to happen? What's the first thing that needs to happen? Has to be created, right? Or in this case, sometimes electronically. All right, what's next? Once it's created, where does it go? Yeah, it goes to the pharmacy. All right, once it's at the pharmacy, what does the pharmacy do to it? No, we got to look at it. What do we do when we look at it? We check it. Okay, once we check, see that it's legit. What do we do next? No, not insurance. Before we put in insurance, what do we have to put in? Yeah, patient and prescription information. All right, so we enter in the patient and prescription information. Then we enter in the insurance. So if they have cash, we skip insurance. But if they have insurance, we go to insurance. How do we know we're going to get paid? How do we know? How do we know we're going to get paid? Which of the following? Well, yeah, when you hear the labels, when you hear the labels printing, that's your cue. Hey, I got new prescriptions to fill.
That means when you enter the computer that it's going to automatically...
Only if it's billed and it goes through electronically. If it goes through the insurance company electronically and they're going to pay for it, then the label will print. Otherwise, you'll get a code, you get a rejection or something.
Oh, okay. So that's the way the computer works.
Yeah, that's how most pharmacies will set up their program. We don't print labels until we know we're getting paid for it.
Gotcha, okay.
Because if you have a bunch of labels printed, you're assuming it's going to get paid for.
Yes.
That means you're going to fill it, patient pick it up, free drugs for everybody. So want to make sure that label prints And then once
That's what you said, we're gonna see on Pharmacy 200,
COM 103.
okay.
Yeah, in COM 103, the computer course, you'll actually read prescriptions, actual prescriptions like we practice on Monday,
Okay.
and you'll enter it into the software, and you'll print out actual labels.
Okay.
Yeah, so you're going to go through everything. All right, so label is generated. What do we do next? That's our Q2
Prescription prepared, yeah.
prep the prescription. And then once we prep it, we need the
Pharmacist check.
the second check by the pharmacist. Patient picks it up, and lastly, counselor. Right, so the pharmacist provides it. Everyone needs to offer it. All right, so prescription is prepared. So step 7 or so. So selecting the correct drug. So we use the triple check system. All right, so the first check is when you pull it off the shelf, right? You gotta look at the label. Second is when you prep the medication. And in pharmacy is when you restock. Okay? So in medical practice, you check the label right before you administer it. But in pharmacy, right when you restock. So in order for us to fill the wrong drug, you would have had to fail 1, 2, 3 checks, maybe even more, to fill the wrong drug. But if you want to fill the correct drug, match this. The NDC number, the National Drug Code. It's going to be on the label. Match it with what's on the manufacturer's bottle, and you got the right drug. Right? Always match the NDC number. Select the correct packaging, correct size for pills, correct containers for liquids and ointments. And then affix your auxiliary labels. So any additional warnings, like may cause drowsiness, take with food, take without food, things like that. Common errors. So look back at your assignments last 2 weeks. How'd you do on your brand and generic portion? Get familiar with those drugs. Wrong strength dosage form. So online A, we got a lot of tablets, but there were ER tablets, and there were some DR tablets. Right? The potassium were extended release, and all the acid meds were delayed release. So not just only tablet, you have to specify if it's extended release, delayed release, etc. Quantity, you're going to learn how to figure out how much to dispense. SIG codes, so strive for accuracy. We are the last offense. The pharmacy is the last offense. Given to the wrong patient, how can this be? Well, we could fill common names, yeah. We can fill everything correctly, everything's checked correctly, but you give it to the wrong patient. I think in LA there's like 40,000 Maria Sanchez's, and that's just LA, so you gotta be careful. Or if you put the medication, you stuff it in the wrong patient's bag, they just go home, oh, take one every day. They don't even read the name, they just start popping pills. You gotta be careful. Mostly for narcotics. A lot of patients will try to forge, get some extra pills. For example, 30, they can turn it into, voila, 80. But there's things we do to go away from that. All right, the things that a pharmacy technician can do. So only remember those 3 from the introduction. Pretty much counseling, interpreting data, verbal orders. Those are the 3 things that only a pharmacist can do. So the tech will help the pharmacist, right? Definitely treat everybody with respect, everything with respect. We can take in prescriptions, whatever form it is, except for verbal, right? No verbal orders. Refill clarifications requests. Usually we just send a fax or an email to the doctor's office. The fancy term for the electronic processing of insurance claims is called adjudication. That's all it is. Electronic billing. That's what it means. Adjudication. Third party in this case is the insurance company. Yeah, techs can fill prescriptions, techs can compound, record controlled substances, handle controlled substances, refer patients, definitely. Any questions techs can't answer? Refer to the pharmacist. Accuracy and safety. Overall, everyone's goal. Now the pharmacist role. So a lot of these will overlap, but those major three, the three main ones, are the ones you want to focus at. So everyone's responsible for correct drug, correct patient, but the pharmacist overall, they're going to be responsible for even some of the things the techs do. Directions are clear during their second check. This is part of counseling, how to take medication, how to get refills. So definitely only a pharmacist. Drug-drug interaction, this is DUR, so that's again part of drug counseling, drug utilization review. Potential side effects, that's all counseling. Accurately billed, counsel patients. So here they said it explicitly. New phone orders, right? So it's only new verbal orders. Refills, refill authorizations, a technician can take that. Because for a refill, there's not a lot of things that can go wrong. It's just same drug, same patient, same doctor, same regimen, just another fill. But for new prescriptions, new verbal orders, pretty much anything and everything can go wrong. Give me an example of a DAW code. What is DAW? How to do something with this guy.
If the doctor says take the brand,
Yeah.
like a direction.
Yeah, so the doctor can specify a brand. The patient can also. Sometimes patients think that one brand works better than the other. So they say, I gotta get the brand name, I gotta get the brand name, or I gotta get this brand. Sometimes we're out of generic, so we have to give the patient the brand. Can we bill them brand? No, so we gotta give them brand name drug, super expensive, but we gotta bill them generic pricing. Or sometimes there's no generic available. So there's many different DAW codes, and what they're for is to justify the cost to the insurance company, because they won't pay for it unless the doctor says, oh, the patient has to have this particular brand. Tell me if the task, pharmacist only, technician only, or both. Offer counseling. Are you sure? Who can offer counseling? Offer it? I think anybody can offer counseling. But who can actually conduct the counseling? Right? So anybody in the pharmacy can offer it. And when a patient picks up their meds, you must offer the counseling. If the patient declined the counseling, you must document it on the pickup log. Right? That's to cover your own butt. Now, if they say yes, you're going to tell them to wait, and then who comes over? The pharmacist. Right? New phone prescription. Pharmacist only. How about phone refill authorization? Both, right? So refills, got to be an idiot if you're going to do something wrong. Overrides drug interactions. So that's part of interpreting data, right? You get a little warning up that says, hey, this might cause a problem. We are not trained to say, oh, if that's okay, that's not good, go ahead and do it. The pharmacist is trained to. So only the pharmacist can. Now, they'll just tell you, go ahead and push enter. That's all you have to do a lot of times to override them, but get their attention. Compound prescriptions. Yeah. So if your veterinarian needs like a beef flavored suspension for your puppy, they can't mix it. they have to send it to a pharmacy. Inform patients of side effects. That is part of counseling. So it is going to be pharmacists only. So remember, MAs, yeah, MAs, you can inform them. Hey, watch out for headaches, pains, rashes. Inform patients on how to take medication. Yeah, that's counseling. Right, not too bad. So that's pretty much it. Those three things: counseling, interpret data, and verbal orders, new verbal orders. So that was the prescription. Here is the label that will go on the pill bottle. So we got the provider. In this case, the provider providing service is the pharmacy. So they'll need an MPI number. Date of service. So when you go to your explanation of benefits, it's always going to refer back to date of service, and it's usually date the prescription was processed. Pharmacist initials, so we know who was on duty. If there's an error, it'll trace back to that pharmacist. We got refills. Everyone knows their schedules and refills. Here's the doctor info. Expiration date. So what's the default expiration? Yeah, 1 year. But just double check if it's pre-printed like that. Here is the inscription. Here is the signa. Then we got the patient info and RX number. The pharmacy will file prescriptions based on this generated RX number. If it is a scheduled drug, you're going to have to file it separately. And usually they'll have like a C here to let you know it's controlled substance. Refills usually have a dot, like your first refill, and then .2 for your second refill. That way it makes it easier for everyone. All right, outpatient, that was retail. All the doctor information was on the prescription pad, on the prescription label. But in the hospital, there's so many doctors, everyone goes in and out. It'll be crazy if we had like a million different doctor prescription pads. So here we just have a generic line paper. As soon as the doctor signs it, it becomes a prescription, a legal prescription. So the role of the pharmacy is to pull out all the pertinent drug orders. There's going to be diet orders, there's going to be lab orders, there's going to be a bunch of stuff on doctor's orders, not just drug orders. So let's read this hospital order. So it says, admitted patient to the 6th floor with pneumonia and dehydration. They have allergies to penicillin causing a rash. So that's going to be pharmacy info. Definitely need to put in that allergy info. Order a complete blood cell count, a Chem 7, a blood culture. So we want to make sure they're not sepsis. And then NS, normal saline at 125 mLs per hour IV. So that's a drug order. So that's pharmacy info. That's the drug order. Next, Tylenol 650 by mouth every 4 to 6 hours as needed for temperatures greater than 38 degrees Celsius. So pharmacy will need to note that guy. And then lastly, starting clindamycin 500 every 12 hours, not 12 degrees. And then they're going to get a multivitamin every day. So 1, 2, 3, 4 drug orders. And then this you'll need to put the allergies in their profile. So we're not giving them penicillin, we're giving them clarithromycin instead. Order a chest x-ray for the morning. So there's drug orders, lab orders, diet orders, all mixed in. Now in order to organize administration, because nurses, they come in and out all the time, they have to exchange information upon shift change. They will use a MAR, a medication administration record. So anytime a drug is scheduled, it's going to be pre-printed. So for example, the NS, it's going to last every 8 hours. The bag will last every 8 hours. So the first one is schedule at 8. So when it runs out, it'll run out at 16, and then the next bag you'll need at 2400. So if it's regularly scheduled, it's printed. Whereas since this Tylenol was PRN, we don't know when they'll need it. So the nurse will print the time and their initial when they administer it. When their shift is over, they always have a little meeting in the nurse's station, and they talk about which meds they give, when they give them, if they skip some, why they skip some, and it's all for patient safety. Do you guys use that?
Yeah.
Yeah.
We do that one, and we change electronically more.
Yeah. So both. And a lot of places now they're tracking like Tylenol, so patients don't get overdose, and they're tracking narcotics as well. HIPAA. So we'll quickly talk about HIPAA. So portability and accountability. Portable, being able to take your insurance from job to job, and accountability is the protected health information. So MPI required that 10-digit number for anybody that moves about protected health information. Safeguards, like your computers, you gotta have screensavers, login passwords. The line for the register like starts 10-15 feet back, so even verbal violations are prevented. Acknowledgement. So health information can be used for a lot of things, for research and also marketing. So anytime you release patient information, you gotta let them know. Remember the relationship between the prescriber, right, the pharmacy, and the insurance company. So HIPAA says you can't talk about the patient's health, right, to anybody, except the minimal necessary for service. So the doctor can talk to the pharmacy about the patient's condition, right? They don't have to ask the patient every time, hey, you got a cold. Well, can I tell the pharmacy about your cold before? So no, that'd be ridiculous. So when it's billing, right? Like, hey, this claim got rejected. Yeah, the pharmacy has to be able to talk to the insurance company, but just about that drug and why it was rejected and how they can resolve it. So we don't have to get their permission every single time. You'll get trained every year. HIPAA certification. What's a MAR? What is it?
Medication administration record.
Yeah, medication administration. Who uses it? Which settings? In or out? Inpatient. So long-term care, nursing home. How many digits in an MPI? 10 digits. How many digits in an NDC? 10 digits as well. HIPAA requires all of the following except. You say A? Anybody else? None of the above? None of the above? Somebody say A, somebody say none. Which one is it? It is. This is OBRA 90. Counseling is OBRA 90. That one's a little tricky, huh? Threw in stuff that is correct, but for a different question. Can a pharmacy disclose protected health information without the patient's consent?
Yes.
Yes, when?
When they're talking to the prescribers or the insurance people.
Yeah, to perform services on the patient's behalf. Just minimal necessary information. All right, that concludes prescription. How do you spell HIPAA?
Not no hippopotamus.
How do you spell HIPAA? Good. HIPAA. No hippopotamus. So when you write your resume, make sure you put the right letters there.